Dr. Jonathan Baugh, he's the Chief Medical Officer of Remote Health Solutions, joining us live now. Good to see you, Doctor. First and foremost, have you or any of your staff treated COVID-19, and what are you seeing?
Yeah, hey, thanks, Shaun, for having me on. Yeah, we're starting to see COVID-19 more and more in the hospital where I'm working, and then within Remote Health Solutions as well. I believe that we were actually the first telemedicine company to monitor a person under investigation in their home. And so that the question of, well, what are we seeing? We're seeing a broad range. I think we're pretty lucky right now where I live and where I work to not be in New York, and not to be in California, not to be in Washington, to be able to see these epicenters and be on that true forefront where they're seeing large numbers escalating rapidly. But we are seeing this rapid escalation even in the more rural, remote areas of the country.
What are you telling patients if they do come in, they test positive for COVID-19? Do you immediately send, this is all new for everyone, do you immediately send them out the door and say, hey, go quarantine yourself? What's that process once they test positive?
I want to actually answer a couple of things about that, and that's actually a great question, because one of the things that as a provider that we're seeing is the fact that we are short on tests. Our ability to actually test the number of patients who are mildly at risk or mild risk or maybe even indeterminate risk but have some symptoms is really limited because we don't have the accessibility to the number of tests that we should be having. And then when we do have positive tests, we're telling patients to be able to go home and quarantine. One of the things that as Remote Health Solutions, as the Chief Medical Officer here, what we're able to do is send these patients home with a device that allows us to monitor them in their home so that they are being quarantined, but we're still able to monitor them, check their vital signs, their blood pressure, their oxygen saturation, those type of things, so that we can have improved outcomes for those patients who have been sent home.
That's huge, continuing to be able to monitor them. That's big. I talked with a friend last night, a nurse practitioner who told me they feel a call to go in and to go and help other hospitals, to help other emergency rooms. Are you seeing that right now with your healthcare workers?
Yeah, we've actually had across the state here. I'm located in Utah. Our company is located in Richmond, Virginia, but I live and work in very southern Utah. And we've already worked across the state to be able to try to figure out how do we reach out amongst the other healthcare workers to supply that need because we know it's going to happen when our emergency departments start getting depleted, because we are going to get exposed, we are going to contract COVID-19. That's sort of a reality. So there is this inherent need within each of us as healthcare workers to reach out. It's a brotherhood, it's a sisterhood. And so we've got some plans in place to be able to work amongst different hospitals and to be able to help other ERs and other hospitals.
Well, listen, we thank you for what you're doing, and to all your staff, we appreciate it. We know you're putting yourself at high risk being around those affected, so thank you very much. That is Dr. Jonathan Baugh. He's Chief Medical Officer at Remote Health Solutions. Take care and stay safe.